The recent resurgence of leech therapy in Kashmir is not just a revival of an ancient tradition, but also a troubling reflection of the skepticism many have toward modern medicine. As the practice gains popularity, particularly during the celebration of Navroz, it's important to approach this resurgence with caution, considering both its potential benefits and risks. Leech therapy, locally known as Drika, once teetering on the brink of extinction, is now seeing a revival among locals in Kashmir, with people seeking relief from a variety of ailments, including joint pain, skin diseases, and circulatory issues. While the practice is rooted in centuries-old cultural and medicinal traditions, its revival, fueled by a sense of distrust toward conventional medicine, raises significant concerns that cannot be ignored. Leech therapy, though used in various ancient civilizations from Greece to Egypt and India, is a practice that should not be embraced lightly in the modern age. The therapy involves using leeches to extract what is termed impure blood, a concept that lacks scientific backing and veers dangerously close to pseudoscience. While some practitioners may tout the method's ability to improve blood circulation and alleviate conditions like joint pain and skin disorders, there is no conclusive evidence to support the broad claims of health benefits. A doctor with experience in modern medicine would quickly point out that, in most cases, conditions such as joint pain or circulatory issues are best addressed through scientifically proven methods, such as physical therapy, medication, or surgery. Even if leech therapy does show some benefits in specific cases, its practice is far from risk-free. Leeches are not benign creatures. They carry the potential for serious complications, including infections and excessive bleeding. These risks are not only unacknowledged by many practitioners, but also underplayed in the enthusiasm surrounding the revival of this ancient therapy. The fact that leech saliva contains bioactive compounds that prevent blood clotting and promote healing may seem beneficial in some controlled medical environments, such as plastic and microsurgery, but using them as a general therapeutic tool outside of those precise settings is reckless. As the 2024 study published in Frontiers in Medicine suggests, careful monitoring is necessary to avoid adverse effects. But who is overseeing these therapies in Kashmir? Is there enough medical oversight to ensure safety? Furthermore, the increasing interest in traditional healing methods like leech therapy can also be seen as a reflection of growing disillusionment with modern healthcare systems. There's a palpable sense of mistrust in conventional medicine, and in a world where misinformation spreads easily, it's no surprise that people are seeking alternative treatments that promise instant, natural solutions. The rise of social media has only intensified this trend. Platforms like Instagram and YouTube have become powerful tools for sharing personal success stories and offering glimpses into the practices of traditional healers. But such platforms rarely provide the necessary medical context or highlight the risks involved. Instead, they glorify an image of ancient wisdom, casting leech therapy as an effective, safe, and even spiritual practice, a dangerous simplification that could lead many to forego professional medical care for something far more risky. It's also important to recognize the cultural aspect of the revival, which, while valuable in preserving heritage, cannot overshadow the reality of the risks involved. Elderly residents of Kashmir remember how certain families made a living by practicing leech therapy, but as modern medical knowledge has expanded, those same families have largely abandoned the practice in favor of more reliable, scientifically supported forms of healthcare. The fact that younger generations are now turning back to leech therapy, inspired by social media trends, signals a troubling cycle where tradition is prioritized over public health. While leech therapy might have had its place in the medical history of many cultures, its use in the present day, without the guidance of a medical professional, is troubling at best. The desire to find alternative treatments should not override the need for caution, and it is essential that people seeking such therapies do so with a full understanding of the potential health risks involved. No matter how well-intentioned or culturally significant the practice may be, it's crucial that individuals and communities do not allow sentimentality to cloud their judgment when it comes to their health. In a time when access to modern medical care is more available than ever, it is concerning that ancient practices are regaining popularity simply due to a lack of trust in more effective, science-backed treatments. In conclusion, while leech therapy may be steeped in history and cultural significance, it should not be seen as a panacea for health problems in modern Kashmir. The trend of embracing outdated and proven treatments poses a danger not just to individual health, but to public health overall. It is crucial for the people of Kashmir to balance respect for their cultural traditions with an understanding of the risks involved in such practices, ensuring that their well-being is not sacrificed for the sake of nostalgia or alternative trends. Without proper medical oversight and greater awareness of the dangers, the revival of leech therapy may end up being more harmful than beneficial.